at 9 o'clock this morning, and they will debut there as well. So this first slide is pretty self-evident. It gives us our total numbers of positive COVID-19 to date as of 8 o'clock this morning. Actually, that's a little bit of a fib. It's probably 7:30 this morning. 1,703 cases. We've had a total of 134 of our cases hospitalized, and we've had, unfortunately, 48 deaths. But more importantly, if you look at the actual graph, you can see basically starting right around Labor Day, we started to see a pretty significant surge in cases, much more significant than we had even way back in March and April, which has kind of put us where we are right now. And I'm going to be able to talk about this surge a little bit more in a couple slides. But you can definitely see starting in September there, we started to really spike in our cases, unlike anything we've seen to date. Oops. Did I mean to advance and it's not advancing? Okay, Kara, I'm froze.
If you go down to the left.
I'm just going to go. I'll do it that way. Okay, so this is our past 28 days. So this is kind of where I said as we started, this is from mid-September until mid-October. We've seen 661 cases. Remember, our total is only 1,700. So in the past 28 days, we've seen a significant amount of our total number of cases just since September 15th. And you can see there that we've had, individual days where we've seen over 40 cases in a day. And up until this time period, we hadn't seen anything that was, I think our record before this was maybe 20 cases in a day. So this has been a significant deal, especially for my staff and our response, and also then what is going on out in the community. Our current lab confirmed COVID patients in the hospital, this is something we also watch very critically. We currently have 15 patients in our two hospitals in Calhoun County. This does not count any patients that are out of county, like maybe at Jackson County at Henry Ford, or in Kalamazoo County at Bronson or Borges. But this is just in Calhoun County at our two hospitals. This number has gone up with our surge. It is a little bit of a lagging indicator. We're watching this very closely over the next week to make sure it doesn't jump significantly again. As of right now, it's still workable, but we need to remember that prior to September 1st, we were looking at 4 or 5 in the hospital at a time throughout the summer, and now we've jumped to 15. We don't want to see that jump and double again. And also the good news is we've been able to release 1,229 of our positive cases. We released them from their isolation orders, which is another way of saying that they've recovered. I'm not going to say fully recovered because that's hard to define, but they've at least been released from isolation and can go about their daily business. A little bit of data on, this is our active case count. So this is the numbers that I look at for my staffing levels and how we respond at any given day. So on October 5th, as a comparable, you can see on a specific day, October 5th, we had 178 confirmed cases that we were still responding to and speaking to daily, as compared to on October 12th, we had 201. Our probable cases on October 5th were 39. Again, those are probable cases, somebody who has an epidemiological link to an active case and has the symptoms and just hasn't had their test results come back yet. And on October 12th, we were following 20 of those. Close contacts, on October 5th, there was 641 close contacts that were being actually contacted every day. On October 12th, 495. So you can see the total, 858 on October 5th, 716 on October 12th. That means on that particular day, my staff would have been responsible to reach out and talk to that many people, either if you were a case or if you were a close contact. So fortunately, we've been able to enlist the help of the state health department, and they have a group of workers that are able to help us with these contacts, because I simply don't have enough staff to be able to make 858 calls in a day. And it's really important that we check in with these folks to make sure that they're still doing okay. And it's important we check in with our quarantine folks to make sure that they aren't starting to show symptoms and need to go get tested. We've heard a lot about the symptoms of COVID, and this is listing all of the different symptoms that our cases have exhibited. I think what's really important about this is if you look at the number one symptom so far that our cases have reported, 72% of our cases reported the cough, and that's a new cough. It's not a cough that somebody's had for a couple months, Kara, but it's a new cough. The fatigue, lethargy, weakness is the next. As you can see, headaches, muscle aches, and fever. And I'm sure you're all thinking, well, gee, that sounds just like, the everyday flu. It sounds like maybe even a cold. And I will say, anecdotally, but I think there's some real data to this, and then we're going to try and tease this out in the future. There has been people, a lot of our cases in the past 3 weeks or 4 weeks of the surge, their symptoms were what they called their fall allergies. And so if you hear somebody saying, oh, it's just my allergies, please have them go get tested. We have heard this over and over where somebody was actually working and they screened and they said, well, these symptoms are just my allergies. They're not, I don't have COVID. And they were allowed to work. And then they found out they got sicker. We got them tested. They were positive, and then they had exposed more people at the workplace that we had to quarantine and all of that. So I would just point that out, that this is really the data that we have on our numbers right here in Calhoun County. And if somebody says allergies, ask them to get tested. Our 3-week surge summary. So you can see a couple things to point out here. I want to go down to in quarantine at the time of onset. We had 119 people that became a positive case when they were in quarantine. That's a good thing. That's what we want to have happen. The reason that we quarantine individuals is because they were exposed to a known positive, and we quarantine them to watch them and make sure they don't become a positive themselves. If they do become a positive, if they were following quarantine, then they became a positive in their own home, and they would not be exposing the general public or at work to people. They wouldn't be exposing people to their now disease that they have. So I would like to see that number go up even more, that most all of our cases would be in quarantine. That would help us flatten this thing back down, but that's a good number. I think the other thing to point out is the household contact, and I did notice there was like I said, these are new slides, and there is a discrepancy that I'm having staff work on between the percentages of the community contact and the household contact. But I do know the household contact is another large group that we're seeing for our current surge and our current cases, which is something that we need to continue to work and stress of how people can stay safe while they're caring for a loved one that is COVID positive without getting it themselves. And the last number on there I want to point out is the source of infection is unknown. About 37% of our surge cases, we don't know where folks got it, which tells us that that's what we mean when we say community spread. So it's community spread is a significant concern, because that means we don't know where people are picking it up. And that's a significant number of our surge cases. We don't know where they're getting it. And I think that is it for this, Kara. So I want to switch over, but I think I need to do something here. I need to fix very quickly. All right.
Bear with us a moment, folks.
Yep, give us a moment. Right here. Okay, so hopefully, I'm gonna transition into a whole bunch of questions like, how's the state of Michigan doing? How about our region in Kalamazoo? Where can we find testing? Um, uh, what's the epidemic orders that we've heard, or there are these new orders about mask mandates and gathering? I'm going to be able to show you where to get all of this at one touch at your fingertips online. And so what I have up here is, this is the homepage for Michigan.gov coronavirus. This is the state's website that has just a whole bunch of information on it. If you haven't been here before, this is Michigan.gov/coronavirus. And it has a lot of information. The first thing I'm going to do is scroll down, and I'm going to show you how to check our numbers on the Michigan, the My Safe Start Map dashboard. So I'm going to click the dashboard, get my banking off the screen. And it takes a second for this to load. It's a very large page. It has a lot of data and information on it for everybody. So this is going to talk specifically about the percent positive, and it's going to talk about the cases per million per day. Those are two things you should have heard about along the way with our response. And this will give us the statewide information, and you can click on any county or any region and get the information for there. So if you're planning on doing any traveling, you want to find out what's going on in the county that you're going to, this is one-stop information. The only drawback is that this information is about 4 days old. So right now it's through October 9th right here. And that's just so they can make sure the data is clean before they actually put it on a public face. So they've been 3 to 4 days behind, but it still gives us an idea of what's going on. So in the state of Michigan statewide, if I click the epidemic spread, our percent positive statewide is 3.8%. That's gone up. That was at 3.5. And these are 7-day averages. That was 3.5 yesterday, day before. And it's been as low as, down in the high 2s. So that's not a direction we want to go. And the new cases per million per day statewide is 82.6. Again, that's high. That's not the highest, but that's a high number. On the chart, I believe, if we look at this, you can follow it over time. You can see where, boy, we dropped way down in Michigan in June. We were at 24.3 cases per million per day. And then look what happened after July. Why would we do that after July? That's probably has to do with the July 4th holiday. And then we kind of tapered off. And then we hit this spike that we're seeing here in Calhoun, they're seeing in the UP and other places. So that's kind of an interactive way for you to look at it. You can also do the same with the percent positive, although the state one is so bad because it's a hard graph to do, but you can follow this at any given date and see where we were. And you can see we were back under 3%, and we are now up to 3.8. So that is the state numbers. Now, our Kalamazoo region, I just simply click over here in the Kalamazoo region, and it will instantly take me to the Kalamazoo region numbers. And our Kalamazoo region, made up of all of these counties here, right here, we're at a 4.9% positive rate, and our cases per million per day is 127.9. So our Kalamazoo region is at a higher rate than the state overall. And then I'm going to go ahead and I'm going to click, here's all of the counties in the Kalamazoo region. I'm going to click on Calhoun specifically. You can see that for the region, we're at a risk level D. Calhoun specifically is at a risk level E. Percent positive is at 4.8%, which has come down. It was up over 5 and even over 6 as late as last Friday. So that's good news. The bad news is our cases per million per day at 190.2. And you can see in our graph that surge that I showed right there that is a problem. And what we have seen, just to give you guys an idea of why, you could be asking yourself that, most of the outbreaks and the gatherings that we have had large numbers of cases at, most of those all of those gatherings included people that were not following those basic, simple, safe protocols, wearing a mask and maintaining 6-foot isolation. There was, in all of those cases that we've had gatherings and we've had outbreaks, that's what's happening. I do not have a case yet from an outbreak where the gathering was following proper protocol. And I'm going to give a shout out to our schools right now to talk about that a little bit more. Right now, currently in Calhoun County, our schools, almost all of our schools have some form of in-person instruction where the kids are coming to school, whether it be a couple days a week hybrid or all 5 days a week.
Sounds right.
A little bit of mix and match. What's important to note is that currently, as of today, we don't have any transmission or outbreaks and haven't had at any of our schools, whether public or private, since they opened up back in mid to late August.
Cases, they just told my wife.
It tells me
Put her on COVID.
that
Dude.
somebody needs to
really?
probably put their,
Cases are rising really fast. They've shut down. Music Factory got shut down. The whole place got COVID. Everybody there.
Eric, can you mute
We were
him?
there 2 weeks ago. It's just they're hyping it up.
That's
It's
bullshit.
gonna be like this. till
Music
the-
Factory, you know why Music Factory did it? Because I was fucking talking to Jeff. And I said, hey, Jeff, these 2 places closed. I think they were just not busy.
Looks like it's somebody
And
named
he
Greg.
said, Bing!
Yeah.
In his fucking head.
You,
So he closed.
Greg. Greg Dunn, could you please mute your phone?
Oh, sorry.
Okay, so what that's telling me, or what that's showing me about our schools is they're following proper protocols. They're really doing a good job of doing that. Both the kids are doing a great job of wearing their masks, and the teachers and faculty and administration are just doing an excellent job. And I think they're kind of leading the way for us. They're kind of showing us, this can be done. We can operate in the midst of this pandemic, and we can operate with COVID, but we need to do it in a safe and smart manner. And if we just follow those couple basic, simple things, I think we can be okay. And we can put we can take this thing that's going up, that's testing, but this here, and we can bring it right back down. But we all need to follow those just 2-3 basic things: wash your hands, wear a mask, and social distance. So anyway, this is what's online, the MySafe Start Map. It's excellent information for state, for county, for region, that you can follow right along every day. Now I'm going to go back, and I am going to say, ask yourself, where can I get tested? Well, this nice website says, look right here, right at the top of the website, don't bring COVID home, get tested. You can find a test site here. I click there. I click here again. And I'm going to put in, Kara, I'm going to put in 50 miles. And I'm going to put in zip code 49015, which I think is somewhere in Battle Creek, Springfield area. And I'm going to hit search. And you can see what comes up. So Med Express in Battle Creek, it'll tell you how far from the actual place that you put that in. Grace Health, Rite Aid Pharmacy, those are the closest ones. Hemington's in Marshall, Oakland After Hours, Bronson Advanced, Family Health. I mean, I can go down the list, but this gives you all the places where you can get tested. It gives you the cost. Here's Albion. At Albion College, they have free public testing. Appointments are strongly encouraged. There's no cost. No doctor order needed there, and anybody can go there to get tested. So you can see that there's really good information there. I'm going to block that. On testing. So if you need to know where can I get tested, this is a great part of the website to find out. You can just click in, put in your location, and it will give you, start out with the closest, and then it will continue to go to the furthest away. And you can put in, I think, 10 miles, 25 miles, 50 miles on up.
I apologize.
Hopefully
You got 2 questions in the chat box
Oh, we do.
for you to check out. One is, can you, like you were just on the testing site, but talking about, is there anyone locally doing any rapid testing?
Some of those are rapid. I mean, we're getting some PCR testing done at some of our pharmacies. The turnaround is 12 to 16 hours. But the rapid test that a lot of people talk about is the antigen test. The antigen test is like a 15-minute rapid test. Unfortunately, right now, the antigen test has a higher degree of false negative and false positive. Therefore, anytime you get one, if you are a positive, we would treat you as a positive, but we would be recommending that they then go to get a PCR test to confirm. And that's a little confusing. So really, rapid tests are good for large groups like what we see in the NFL or athletes, where you're testing a bunch of people every day and you need a rapid result. I think even, I think that's what they're probably doing at the White House and things like that. But once you get that result back, you really should confirm that with a PCR just because of the higher rate of false positive and false negative. The PCR test it is a very, very, very effective test. And if you are a PCR test positive COVID, you are a positive COVID. There's been I can't even think of one that I've heard yet that has been a false positive from a PCR test. Was there another question, Kara? Because I can't see them.
Yes, you have one in here. Oh, hang on, sorry. There has been a lot of concern expressed in the community about students and teachers contracting COVID. What guidance is given to schools about how they should proceed and whether schools should pause instruction, go to 100% remote learning, or continue operating for in-person instructions?
Oh my gosh, I don't have time for all of that, unfortunately, but that's a really good question. All I can say is I've been meeting with all of our superintendents, and I've met with our private school officials several times as well. But I meet with all of our public school superintendents weekly, and we've been meeting that way since February. We have discussed protocols and proper protocols, and there's some guidelines or guidance that I have as a public health department on what I would be looking for to recommend if I was going to recommend somebody pull back from in-person instruction. I believe that in-person instruction is very important, and I think that that's what we need to try to do as long as we can do it safely. As I stated before, as of right now, since we've been open in mid to late August, we haven't had any cases of transmission or outbreaks at any of our schools. It means that they're following the proper protocol. And that proper protocol was actually what came out with the governor's work group that put together the school protocols that said that everybody had to wear a mask and said that we needed to try to social distance as much as possible. Some classrooms you just simply can't. But that's what they're doing, and they're doing a great disinfection protocols. And so if you want to know, your schools have it and should have it on their website, and you can read their plan and what they're doing. But as with anything, a plan is only as good as it's not as good as the paper it's written on. You actually have to implement it. And so far, it appears our schools are implementing it in a very good way. And so bottom line is, if we were continuing to see an increase in our cases in the community, and we were starting to see transmission and outbreaks within a certain school district, that's when we would be having conversations with our schools about maybe pausing for 14 or 28 days and going virtual just to let everything calm down and to stop the transmission from one person to the next. So that's a very quick answer to something that's very complicated and would take a lot more thought to be able to answer. Kara, I wanted to show one more thing on here before we answer another question, and that is important for this group, and that is right here. Executive orders and directives. We all know that the governor's authority to issue executive orders under the previous law that she was issuing her state of emergency under was deemed unconstitutional by the Supreme Court of Michigan. And I would note that the orders themselves were not taken up, were not something that they looked at. It was the fact that her authority to issue those without legislator approval of extending the state of emergency is what was found to be out of line. Having said that, what's happened now is, and this has happened over the summer, we just didn't really pay attention, but these MDHHS epidemic orders that Director Gordon has issued, you can see he started issuing these on March 23rd. They mirrored pretty much what the governor was putting out. And the current order that we are under currently is right here, gathering prohibition and face covering order. And I know Carol wanted me to just bring this up. We are currently under a face covering order. Here's the, the language of the order. You can find it online, and it goes through. It talks about gatherings. It talks about when we have to wear a mask. It talks about when we don't have to wear a mask. And all of this is online for people to review. I strongly recommend you find this, especially as a business owner. Because these are the things that I talked about earlier, that if we can do a couple simple things, wear a mask, social distance, and wash our hands. If we can do that, then we can stop seeing these spikes that we're seeing right now, and we can stop those hospitalizations in their tracks. I don't want to see that hospital number double. I'm worried because it's basically tripled since July or since August. I don't want to see it double and get up to 30 people in the hospital, because at this point in time, we only have about 50 critical care unit beds in Calhoun County. So we don't want to see ourselves go that way. There's some examples out there right now in Wisconsin that are a problem. So we just want to make sure that we're doing everything we can to keep ourselves safe, to keep our families safe, keep our workers safe. And right now, I'm just asking everybody to please wear a mask and social distance as much as possible. And Kara, I have got to run here in a second.
I have one really quick question. What is PCR test?
The PCR test is basically it's the new. I'm gonna get it. It's a good question. It is it's the test that we have been utilizing all along for COVID. Typically it's been taking 24, 48, 72 hours for results. Typically that's because we used to have to send these away. Now we have labs that are closer that have the ability to run these. So that's why we're getting a better turnaround. But it has to do with actual, and I'm going to kill this, so I would ask you to Google it. But it's basically it's taking pieces of genetic material. So it finds that genetic material of the virus, and that's what causes you to get the positive result. It's very, very, very accurate. And that's a terrible way to say it, but I said it. Say that again.
What does PCR stand for?
I can't remember.
Okay. We said it, so we were all kind of like, what is that? So yeah, well, thank you. Are there other questions in the chat box right now? It does not look like it. So I know that you have to run, Eric. I want to say thank you very much for this information. It's very helpful. Was hoping that you would be able to answer those questions that I gave you. Greatly appreciate that. We do have a lot of businesses that are still trying to figure things out and how to navigate those orders. So thank you for showing us the website where we can go and see those executive orders. That's really important. I know that it's getting to get a little bit crazy in regards to not knowing what is the right method. So thank you to your staff, Eric, because I know that since February and a little bit before, you guys have been really working very hard. And it's been great to see the communication come out from Calhoun County and the accuracy and the way that things have been moving. It's great to have the information, and you've been very receptive, and I greatly appreciate it that you took time to speak with the business community today. So thank you.
Thank you, Kara, and thank you to everybody for all the work you're doing. This isn't easy. This is unprecedented, but we can do this, and we can knock this thing back. We don't have to accept it. We don't have to let the virus beat us. We can beat it, but we've got to do some things that maybe don't feel comfortable. And if we can do that, then we can knock this thing back until we get the vaccination. Okay? All right.
Great. Thanks, Eric.
Thanks, everybody.
All right.